Hello, everyone, and thank you for joining me this afternoon. My name is Gary Wilson, Senior Assistant Director of Admissions at Massachusetts College of Pharmacy and Health Sciences, and this presentation is a guide to the different careers and outcomes you can find here at Massachusetts College of Pharmacy and Health Sciences. With that said, just a little bit of information up top. Through the course of this presentation, you will see these four symbols on each of these slides. These four symbols are career segments that are highlighted to help provide a little bit more context as to what that career, what form of that career takes within the professional field. For a purple mark, that's healthcare practice, patient care focused, very day-to-day and very interactive on that side. With a red mark is for research and disease prevention. For a green mark is on the business and technology side of the healthcare field. And for a blue mark is the life sciences field, the field of study where individuals are more interested in the biological and chemical side of the healthcare space. Starting off with our flagship program, our PharmD, or Doctor of Pharmacy. At MCPHS, this is a direct entry 6-year career for that full doctorate. The first 2 years of the program are pre-professional, followed by 4 years in the professional phase. A pharmacist does a wide variety of different things within the healthcare space, from interacting directly with patients, dispensing medication, helping guide patients as to what symptoms they need to look out for, what side effects to look out for, but also on the industry side, working within businesses and clinics, helping lawmakers come up with new ways to pitch and implement new drug policies, as well as education, helping families and students really learn what medication can do and how to create it. If you're interested in chemical creation and compounding, we'll touch on that a little bit later, but as a pharmacist, you also have the potential to do that. Down at the bottom of this slide, you will also see the current earning potential for a pharmacist within the United States. These numbers are pulled from this year's Bureau of Labor Statistics Guide to Professions, so if you'd like to double check these, you absolutely can. Our pharmacy program is our flagship program at MCPHS. We are the second oldest institution of pharmacy in the country. So if you do want to become a pharmacist, we have the direct program to get you there as quickly as possible. Next up is a nurse. I'm sure all of you understand what a nurse is, but just as a quick overview, a nurse is the front line of every healthcare space. They're the first person a patient is going to interact with. They're the one who's going to have the most hands-on and one-on-one time within a patient within a floor. They have to be fast-paced and dynamic in order to come up with new solutions to problems, as well as how to better treat patients within their care. Nurses can have large lists, small lists. They can work in large hospitals, small hospitals, clinics, and even in places like education, as well as law and policy. At MCPHS, we have a bachelor's degree in nursing. It's a 3-year accelerated BSN, so you graduate in 3 years with that full Bachelor of Science in Nursing. We also have master's programs in things like nurse practitioner, family health nurse practitioner, mental health nurse practitioner, as well as things like Doctor of Nursing as well. That earning potential down there at the bottom is a range that covers the entire country. So the higher end of the range is for more urban and developed areas, while the lower end of the range is for less developed areas. As you might know right now, there is currently a nursing crisis out there as more nurses are being asked to go to school and get higher levels of degrees. That's why we only have a bachelor's degree at MCPHS. We don't do an LPN or anything like that because we want our students to come out with the most advantage possible and not be asked to go back to school for anything that they want to do. Next up, we have an MPAS. This will be the only time you will see this career referred to as an MPAS. Most people just refer to them as PAs or physician assistants. A physician assistant is an autonomous person within a hospital space. You work underneath a physician. You have nearly the same level of responsibility. You can examine, treat, diagnose patients. You can even prescribe medication. You basically can do everything besides authorizing and conducting surgery on your own. You can independently practice as well within small clinical spaces as well as large hospitals. To become a PA, you do need a master's degree. For most programs, you will find a 4+2 for a master's, and at MCPHS, you'll actually find a 3+3. 3 years undergraduate in our pre-medical and health studies program, and 3 years graduate to finish up with that full master's at the end of the time. The final year of your PA program will be fully clinical, and at schools like MCPHS, you will have clinical experience in all different phases of PA. You'll see things like surgical PA, you'll see things like mental health PA, geriatric, the NICU, the ICU. We want you to be able to confidently say, I've seen everything, I've operated in all of those spaces, and I know which one is the right choice for me. That's why we have to go through and see everything possible. As a PA, you can really operate wherever you want as well, and PA is one of the fastest growing industries within the medical field. So if you're interested in working on the patient care side and want a little bit more independence within a space, I would highly recommend checking out a PA program. From there, we get to some of our smaller programs at MCPHS, starting off with a radiation therapist. A radiation therapist is the person who is implementing and giving the drugs to cancer patients who need it to be going through things like chemotherapy, as well as other radiation-based treatments. You're the person working hands-on with those individuals. You're the person there to make sure that anything they need during the course of their treatment is taken care of. You're the one making sure they're getting the proper dosages, as well as making sure that there are no individual side effects that need to be taken care of. This is a hard career. A lot of compassion and sensitivity are required for individuals within the radiation therapy space, but it is one of the most rewarding careers out there as well. You're helping people and guiding people through some of the scariest moments of their time, and you can really develop a connection and emotional bond with your patients going through them. You may be working with patients for a long time as well, so you get to spend a lot of time with individuals and really build up that personal relationship. You do need a bachelor's degree to operate as a radiation therapist. At MCPHS, that's a 3-year program as well. Graduate in 3 years with that full Bachelor of Science. Following that, we do have physical therapy. As a doctor of physical therapy, you're working with individuals who are coming through traumatic injury, perhaps traumatic brain injury as well, individuals who need to relearn how to function, how to walk, how to move, how to move their hands again after breaking their arm, all sorts of things like that. You do need to be a doctor to get to be a physical therapist, but this is a doctorate that doesn't require you to go to medical school. You go to institutions like MCPHS, where we actually have a 3+3 program for that full doctorate. First 3 years in our health sciences, public health, or health psychology program, and then 3 years in our Doctor of Physical Therapy program. As a physical therapist, you're really helping individuals recover their quality of life and helping them through a wide variety of different things. You're mostly focusing on large movements as a physical therapist, and in a little bit, we will focus on the other side of physical therapy that does a little bit more of the fine motor skills. Oh, it's right here. So this is for our Masters of Occupational Therapy. Occupational therapy is very similar to physical therapy in that you're working with individuals to help improve their quality of life, but as opposed to physical therapy, where you're mostly working with individuals who have come through injury or traumatic brain loss, as an occupational therapist, you're working with individuals to help them improve their quality of life for other reasons. Many occupational therapists will work with autistic children for long periods of time to help them learn skills that they need in order to operate within the world. Many occupational therapists will be working with their patients for a very long period of time, perhaps even multiple years. So you really also get to build up that relationship and that one-on-one patient to provider interaction. To be an occupational therapist, you do need a master's degree. It's a 3+2 program at MCPHS, and you'll also find other similar programs as well. The easiest way to remember the difference between physical therapy and occupational therapy: physical therapy is for big dynamic movements, relearn how to run, relearn how to walk, but occupational therapy is there to help you relearn how to button a shirt or perhaps flip over a pancake. Everybody knows what an MD is, of course. This is a medical doctor, someone who's completed medical school and is there to help patients through whatever they need. But what you might not know is that an MD is absolutely everybody you can think of who you consider to be a doctor. A surgeon, that's an MD. A psychiatrist, that's an MD as well. Anesthesiologist, MD. The list goes on and on. To become an MD, you follow the same path for whatever you want your outcome to be. You go through an undergraduate program for 4 years, and then off to medical school after that to then specialize within medical school. That's why traditionally you won't see undergraduate programs in things like surgery or psychiatry, just because those are things you declare on the medical school side, not the undergraduate side. To become an MD, it does take a lot of education and take a long time, but the rewards are countless. Many students who are interested in going into medical school think that they have to major in a biology or chemistry program in order to become an MD, and that's actually not the case. Something that we've been working on over the past couple of years and in contact with medical schools over the past couple of years as well, is that the major you are most likely to get into medical school with at the moment is English. Yes, that's right. An English major who has all of the hard science skills needed to go to medical school will also have all the soft sciences skills needed to actually communicate with people, to be able to connect with patients and be able to move from those spaces. The reason I tell you all this is because I want you to understand that to become an MD, you can really take whatever path you want. If you want to study biology and chemistry, fantastic. Those are, of course, still going to be great paths to medical school. But if you want to study things like health psychology, public health, health sciences, those are also great ways and will really give you the tools to help you stand out on a medical school application. A DO is very similar to an MD in that you are actually doing the same thing. A DO is a doctor of osteopathic medicine, where an MD is a doctor of allopathic medicine. The differences between allopathic and osteopathic medicine have actually shrunk over the past couple of years. Previously, osteopathic medicine would require and offer many treatment plans that allopathic doctors would never even consider. Things like nutrition, diet and exercise, chiropractic, acupuncture, things that don't fall within the traditional Western space of medicine. However, over the past 2 decades or so, MDs have started to offer and prescribe many of the same treatments as DO, especially things like nutrition and physical therapy. So a DO and an MD are functionally the same thing now. And as a DO, you can do all of those same outcomes as you can as an MD. If you'd like to be a surgeon within the doctor of osteopathic medicine, you can absolutely do so. You want to become an anesthesiologist? Absolutely possible as well. The differences at this point really are just what school and what training you're focusing on. A DO focuses much more on treating the patient, not the illness or disease, where an MD focuses much more on treating that disease. A healthcare manager, that's an individual working on the more business side of healthcare, is an incredibly important person within the healthcare space and not someone you may think about very often. They're the person coordinating different medical staff and administrations, making sure things like hospital structures and clinical structures are running appropriately, making sure patients have access to all the different resources that they need in a timely and upfront manner. Healthcare managers are incredibly important and only becoming more important as healthcare changes dramatically with new things like virtual care and on-the-go care via things like apps on your phone. Healthcare managers are there to make sure that patients and clinicians both feel like they are getting all of the worth out of their time and that everyone is feeling properly supported. How do you get there? First, a bachelor's degree in something like healthcare management or data analysis and technology, which is actually our newest program at MCPHS. And then you could actually follow that up with a master's in business administration and healthcare management, also offered at MCPHS. If you're interested in working in places like Moderna, Merck, pharmaceutical companies like that, I cannot recommend this career path more. Sonography is the fastest growing imaging modality in the United States as we start to shift more and more towards ultrasound as our primary imaging modality. Sonography, or diagnostic medical sonography, is that big fancy name for ultrasound. These are the individuals using sound waves to create lifelike images and live action images up on a screen. Many people will see a sonographer for pregnancy, but sonographers actually have a lot of different roles. Many muscles are properly pictured via sonography, so many sonographers do that, and brain scans are becoming much more popular with sonographers as well. At MCPHS, we actually have 2 different sonography programs. One, a general program where you learn to scan 99% of the body, and an echocardiography program that allows you to focus wholly on the heart, as the heart is an incredibly complicated muscle and really needs its own program in order to understand how to get proper pictures of it. You do need a bachelor's degree to operate as a diagnostic medical sonographer, and at MCPHS, it's a 3-year degree. Now, as a fun aside, if I was to ever go back to school, this would be the career path I would take, a nuclear medicine technologist. This is a person who is using radioactive drugs for imaging and therapeutic purposes. You're also the person creating those radioactive drugs, so you're the person being able to create iodine tracers within a lab setting to then go and administer it to a patient to take better images of what they are doing. Nuclear medicine is incredibly important when it comes to imaging things like small organs as well as blood veins and clots. So nuclear medicine is becoming very popular. You do again need a bachelor's degree to operate as a nuclear medicine technologist. We offer a 3-year program at MCPHS. And for individuals who are interested in this, we actually work directly with the Brigham and Women's Hospital to get our students into their clinicals and lab spaces as early as we can to help them get that experience, that hands-on experience as quickly as possible. A pharmaceutical researcher is an individual who is working on the research side of pharmacy. Hey, it's in the name. If you are someone who loves chemistry, who really loves creating and compounding different things, who are really kind of interested in what drugs do to people and what outcomes they can do, I highly, highly, highly recommend taking a look to becoming a pharmaceutical researcher. As medicine changes and as things adapt, we need more and more great lab researchers who are willing to do the work and and who really have a passion for understanding and creating new medication that we can administer out to society. A bachelor's degree in pharmacology and toxicology, pharmaceutical sciences, or similar programs like that are great pathways into that program. Many students will also take the opportunity to get a master's or PhD in chemistry or pharmacology and toxicology afterwards as well. As a pharmaceutical researcher, your job limit is, or there is no limit to your job potential. You can work in large companies like Merck, you can work in small startups in Cambridge, you can really do anything you want towards that next and new horizon into pharmaceutical research. A clinical researcher takes all of the work that a pharmaceutical researcher is doing and adapts it over to the biology side. You're working much more on the patient side of things, working with human tissue, blood, fluids, and things like that to help identify and rule out diagnoses. This is someone who is working traditionally within a lab and hospital structure, administering new medication to patients, seeing how they react, and then also taking different samples from patients to see if we can identify new diseases and new viruses. A bachelor's degree in medical molecular biology or biochemistry are great pathways to this, as well as master's and PhD options. Much the same as pharmaceutical researcher, you can really do anything as a clinical researcher within biology. You can go to the largest hospitals in the country, you can go to smaller clinics. There will always be options out there to do that research, to gain that experience, and to really help assist the world moving into new adventures. As someone who wears glasses, I see ODs all the time. This is an optometrist, a person who is focused on ocular health, improving vision for their patients. You either are operating within a private practice traditionally or a large hospital structure. As an OD, you're actually someone who can own and operate your own clinic. I know many ODs who have finished up our Doctor of Optometry program and then taken our MBA program to be able to go into private practice and run their own clinics out separate from any other hospital structure. You do need to be a doctor in order to become an OD, but you don't have to go to medical school. In order at MCPHS to become an optometrist, you just have to do 4 years in our pre-medical and health studies program, or take the 3-year option that we also offer, and then 4 years in optometry school after that. Eye health is incredibly important and a fast-growing field as well, as more individuals are taking care of their eyes in a lot of different ways. So if you are interested in OD, you are interested in working on the patient care side of things, but maybe don't want to go to medical school, this is a great pathway as well. A public health specialist, before the pandemic, I'm sure many of us had really not a lot of ideas to what a public health specialist does, but nowadays, many of them have become much more present of mind. These are the individuals who are guardians of the population's health, who are doing things like vaccination campaigns, understanding why society is healthy in the way that it does. What can we do to develop better laws and regulations around the healthcare industry? How can we promote good health practices to different people? They are really involved in every step of the healthcare process. Many public health specialists will start with a bachelor's degree in public health before finishing that up with a master's of public health after that. Many public health specialists will also go to law school after finishing up the master's program. So if you're interested in going into government work or law work, this is also a great pathway to stay involved in healthcare, but have that law focus. Veterinary medicine is not something many people consider part of the healthcare space, but we at MCPHS think it's actually a really, really important part of healthcare. Why? Because the health of our pets is one of the most important parts of society and something people really, really care about. As a vet, you're the person there making sure that an animal is healthy, walking them through the traditional checkups and visits like that, helping diagnose any issues that are happening, help treat anything that's happening. You're really the front line of defense for anybody that might need help with their pets. You do have to go to vet school in order to become a vet. Vet school is one of the 3 tertiary institutions of education after secondary education. So there's medical school, there's vet school, and there's dental school, which we'll touch on a little bit later. After vet school, you'll probably have to do a residency as well. But after that, you're free to open your own clinic or go work in an established animal hospital. At MCPHS, we offer a 4-year program in pre-medical and health studies with a vet medicine focus to help you get the internships and research you need to really help stand out as a veterinary school applicant. Dental hygienists are individuals who help dentists within a dental space. They're the individual conducting cleanings, doing disease screenings. They're the person who will take and review your x-rays. They'll collaborate with dentists moving forward. To get there, you can either get an associate's degree in dental hygiene, or at MCPHS, you could pick up a full bachelor's degree in dental hygiene as well. The earning potential with a bachelor's degree in dental hygiene is much higher, which is why we offer that bachelor's degree to help you move forward. At MCPHS, we actually have our own dental hygiene clinic on campus as well. So you can actually be working with individuals in the MCPHS Society, giving cleanings to other faculty and students, as well as people throughout the community to really help get that hands-on experience and move forward from there. Once you finish up a bachelor's degree in dental hygiene, you'll then sit for your dental hygiene exam, and provided you pass that licensure, you're then able to go and practice and really help people get their smiles back and feel much more comfortable about themselves and feel much more confident in their teeth. On the other side of dental hygiene is, of course, a DMD or a dentist. A dentist focuses on oral healthcare. They require a combination of dexterity, a keen eye for detail, and the ability to visualize in 3D, simply because they need to be able to kind of construct your perfect smile in their head. They need to know how to best treat you, what is the best treatment options, what they can do to really help your smile out, how to help your mouth health moving forward. They need to know a lot of different parts like that. In order to get there, you will do 4 years in an undergraduate pre-medical and health studies program, or in some cases, like at MCPHS, a 4-year program in dental hygiene. And then after that, you're off to dental school. In dental school, it's traditionally 4 years of education, followed by additional residencies after that. I mentioned this before, but radiography is for X-ray and MRI. As a radiographer, you're using X-rays and other radio waves to help create accurate images. X-ray is still the most popular imaging modality when it comes to things like bone health and bone density, as well as for things such as breaks and sprains within our musculoskeletal structure. To get there, you do need a bachelor's degree in radiography or MRI. And at MCPHS, you can actually pick up a 1-year certificate in the opposite once you finish up the first program. So you can do a 3-year bachelor's degree in radiography and then a 1-year advanced certificate in magnetic resonance imaging, or you can do a 3-year bachelor's degree in MRI and then a 1-year degree in radiography afterwards. We also have programs in PsyD and PhD. These are individuals who are working within the psychological space, but not quite as a psychiatrist. These are people who want to focus on therapy, who want to help individuals with counseling. First is a bachelor's degree in psychology, followed by a master's in either a Ph.D. in psychology or a psychological doctorate, which is that PsyD. Yeah, and you're the individual really kind of being there to help a person through their therapeutic actions, how to better implement therapy, how to come up with new therapeutic strategies. What can we do to help individuals get involved in therapy? You're really the person helping out with or running and conducting a therapeutic office. So, in conclusion, the question is, why pursue a career in healthcare? And the answer is because the Bureau of Labor Statistics projects that the healthcare industry is going to add at least 2.6 million new jobs by 2030. On top of that, MCPHS graduates have a median annual earnings of $124,000 10 years after first enrolling at MCPHS. What that means is that you're graduating and moving into a career with endless opportunity, with new jobs available every year, with high salaries and high job security, and the opportunity to take new experiences every single day. New patients, new diseases, new implementations, new strategies, new diagnoses, the list goes on and on. And more than anything, you get to help people. It's one of the most important things you can do within our society is being involved in healthcare, being involved with people's health, helping them feel more confident and healthy within their bodies in every single different form. That's why I personally think that a career in healthcare really is the best thing to do moving forward. If you do have any questions, please don't hesitate to reach out to the admissions team here at MCPHS. We're more than happy to help out. Have a great day.